Good evening, ladies and gentlemen, and welcome to KNDI ATRI Live. This platform is facilitated by Kenya Nutritionists and Dietitians Institute, which is established under the Nutritionists and Dietitians Act, Cap 253B. Under Section 6G and Section 6H, KNDI is mandated to provide public education on dietary and nutritional habits, and also to train nutritionists and dietitians. Kindly note that the discussions that we will have today are strictly for public education and professional guidance. They do not replace individualized nutrition consultation, which you can get from KNDI registered nutritionists and dietitians, whom you can verify through our website www.kndi.institute. Today's discussion will focus on levels and specializations in nutrition practice in Kenya, and we are honored to host Dr. David Okeyo, the Chief Executive Officer of Kenya Nutritionists and Dietitians Institute and Senior Public Health Nutrition Scientist. Karibu Daktari.
Thank you.
You can proceed to introduce yourself and give us a brief overview.
Thank you, Laura, for the purpose of those who have not watched my, of course, events in YouTube, and even when I'm addressing media, I would introduce myself. So my name is Dr. David Okeyo. I'm a Senior Public Health Nutrition Scientist, the CEO, Kenya Nutritionists and Dietitians Institute. I'm also doubling as the Chief of Party for ATRI programs, which direct some of our service delivery ends. And I want to say I'm also a professional by virtue of classification that I'm going to talk today. And thank you very much for hosting me again this time around. Yeah. Thank you.
Thank you. We'll go straight to our first question. In the context of regulation of nutritionists and dietitians, what is professionalism and how are they recognized?
Thank you, Laura. I think maybe before I get into the meaning and, of course, definitions of professionalism, I want to refer to my last recording. Yes. When I was interviewed the first time. I talked about the food nutrients profiling, and one of the things that I was doing was to make it a knowledge for nutritionists and dietitians. So at that point, both of them, both categories, were targeted. Now today, I want to focus on professionalism and see how best we can make Kenyans understand who a nutrition professional is, and also at what level do they practice within our scope of practice. So you've asked me about professionalism. It comes from the word a professional. Yes. And a professional in the context of nutrition and dietetics is one who is trained in nutrition and dietetics content, which can either be at degree level, at diploma level, or certificate level, and sometimes postgraduate level, and registered as a nutritionist or dietitian, and at the same time licensed to practice as a nutritionist and dietitian within a specified code of ethics. And when you talk of code of ethics, it means they have signed, having read and understood the content. With that, then, they can practice in Kenya within Cap 253B. So that is the definition of a nutritionist professional. So maybe just to be clear on this, is that for someone to be qualified as a nutritionist professional in Kenya, I said, number one, they must have been trained from a KNDI recognized institution at certificate, diploma, or degree, or they must have gone through a postgraduate program in the respective universities on matters of nutrition, and so registered and licensed. That is when they will be recognized, but only after they have signed a code of ethics for the practice. Thank you.
So thank you so much. So you've said the nutrition professionals have to sign a code of ethics before practicing. So could you kindly explain the different levels of training and classification in nutrition and dietetics in Kenya and their scope?
Thank you. Now, getting into the levels, you know, we have a creature that is called a nutrition and dietetics technician. That is the lowest level of training. And that lowest level comes from a certificate from any recognized institution. If they have pursued nutrition and dietetics course at certificate level, they become nutrition and dietetics technicians. If they register for diploma, then they will become technologies, and we have two different technologies in that category. So any student that has done diploma in human nutrition and dietetics can either specialize as a nutrition technologist or a dietitian technologist. Now, this level are those who have pursued level 6 in the curriculum for nutrition and dietetics at respective institutions. For those who have done certificates, who are technicians, they pursue level 5. Then we have now the degree level. Now the degree levels training are those that have been classified at the moment as nutrition officers, which we are going to change very soon. But the degree level pursue human nutrition and dietetics at BSc, and then they are specialized in 6 areas. So we have the clinical nutritionist. That is a classification for the graduates of degree level training. Then we have clinical dietitian. Then we have food service diet therapist. Then we have public health nutritionist. Then we have community nutritionist. And then the last classification is food science nutritionist. Those are 6.
Yes.
Yes, so we will find a graduate of nutrition and dietetics coming out with a degree in human nutrition and dietetics. And then we will classify them. Now, how do we classify them? We classify them on the basis of competency building, either through internship, and after which they are examined orally, and then they are publicly licensed, so that their classification comes out well during public licensing, and they will be given a tag and a license to that effect. So those are the first levels with the graduates from the university. Now, for those who have gone through postgraduate, they take the classification based on their previous classification at degree level. So if somebody is a clinical nutritionist, they can still pursue postgraduate programs in clinical nutrition, for example, MSc. And then also alongside their CPD programs, we can also classify them. And at that level, we classify them as scientists. So any nutritionists that have done postgraduate degree, masters, and PhD, we classify them as scientists. And we have different levels of scientists. So when you have masters in nutrition, depending on the concentration of your competencies by evidence of documents like publications and practice. We can actually give you scientist level. And then if you have a PhD and you have high level record of publication in your area, we can give you a senior scientist. And then when you go further and have good record in your area with publications and grants, we can give you advanced senior scientist. And so whenever we talk about masters, then it has to be reviewed, which means you must submit your details, the CVs, so that a given panel can look at it. So that from your records, we can now know where to place you as a scientist. Now, I would want to stop it at that point because we are going to make this more clearer in the subsequent sessions, particularly when we are dealing with equivalence. And this scientist classification, we should also know that they are founded on the 6 classifications for a degree program. Now, other than scientists, we have also some classifications that we'll talk about later, that is specialization. So I think at that point, maybe it is clearer what kind of levels we have. Yes. And we have a document to that effect that very soon the professionals will be receiving so that they can know where to position themselves. Thank you very much.
Thank you, Dr. You've talked about specialization. Could you kindly expound more on the specific specializations? And do they need any additional competencies?
Yeah, let me say, when you talk about specialization, we are looking at the focus for training and also looking at the focus area for practice. Now, anyone who chooses a specific classification, let's start from the diploma because that is where we initiate the classification. We have those that would want to practice as nutritionists, which means they focus on the science of food and nutrients and how that relates with the human body. And there are also those who want to focus on dietetics, which means that they are looking at use of food or combination of food to manage a healthy and unhealthy condition. So if they want to do that, we offer professional examination in those 2 areas. And once you pass, then you begin to build your focus of practice within the area by evidence of continuing professional development. So if you want to pursue clinical nutrition diploma and to become a clinical nutrition technologist, then your focus will be concentrated on nutrition competencies. And that means that you'll be looking at areas of diagnosis, assessment, and referrals. When it comes to clinical dietetics, then you'll be looking at diet therapy. And so you'll be looking at combination of diets and how it can be used to manage healthy and unhealthy conditions of a human being. Now, when we go to the level of degree, we have, let's say, clinical nutritionist. Now, in many times, the clinical nutritionist will find themselves working in the health facilities. But sometimes, they can also work in the community settings, particularly focusing on clinical trials, if it is research, and also if it is high-level clinical intervention, like imam, for example. Now, this category, their focus should be on diagnosis. And when we talk about diagnosis, they'll be looking at vitals, and they will also be vital statistics, and they will also be looking at nutrition assessment, diagnosis. And this can also include social assessment, dietary assessment, and all those with the approach of ABCD. ABCD means anthropometric, dietary assessment, clinical assessment, and then, of course, anthropometric, biochemical, clinical, and dietary assessment. And to some extent, we look at mental assessment, which are social assessments. And when they discover the baseline, then they can now make referrals. Now, the dietitian, clinical dietitian, the focus is on interpreting the diagnosis for a clinical nutritionist and coming up with the food equivalent quantities in terms of nutrients. And of course, the outputs like calories that a client would require to maintain healthy or even to target a particular disease. In this case, their focus should be on food itself, and that means they have to come up with calculations. Now, calculations here, they would use different formulas, and the nutritionists themselves know which formulas to use to arrive at a particular requirement in terms of nutrients based on their interpretation of the condition from a clinical nutritionist. Yes. Now, in this case, they are also required to come up with menus, different menus targeting different conditions in a hospital facility, so that they become another area, another expertise for referrals from a clinical nutritionist. Now, once this person, that is still clinical setting, receives, interprets, and comes up with quantities needed, then the nutritionist, who is a clinical dietitian now, by specialization, will now go and make referrals to the food service diet therapy. Now, this is a very close, a dietitian who closely work with the caterers. So they're the ones who come up with real food. They do real food conversion based on food exchange list. So having received the total requirements, they can now plan for real food combination, looking at how they can be put together to give us what is needed. Now, what this means is that the three are working in clinical setting. If it is hospital facility, we need all of them in every facility if nutrition service delivery was to work properly. So that we'll be seeing someone who is in charge of the front line, that is a clinical nutritionist, with the diagnosis. And then someone who is in charge of planning, that is a dietitian. And that person will be involved with calculations to see quantities needed for that person. And then the last one, who now supervises conversion of the quantities into real food. And that person must be in the kitchen and can also supervise feeding process to see whether the food was consumed or not. That is clinical setting. Now, when we go to public health, nutrition, we are looking at a nutritionist that would focus more on understanding policy framework. This nutritionist will also be focusing more on macro level interventions and look at regulatory framework. So when we talk of policy framework, they work at the level of interpretation of policies and ensuring that interventions are aligned to the policies. So they can work in the county settings, trying to come up with the policies or review those existing ones and make recommendations. They can also work in national government. They can also be linked with international policies so that they can actually become those that drive the agenda of policy capacity building for nutritionists in the country. That is macro level. Yes. Now, when it comes to community nutritionists, these are household nutritionists. They are actually those in touch with the members of household as a setting. And these are those who should actually be working now with community health promoters, training them and also ensuring that they get into household to see what is the problem with the households in that particular setting. Their work will be actually community diagnosis to see different community problems. So when they now link up with public health nutrition, then they can also be trying to see whether policies are working at household level. So their focus is on micro level. So when they are in the household, they can work together with public health officers. They can also work together with community health workers, if they are the social workers, and ensure that a household is given basic knowledge when it comes to prevention. So actually, they are the key promoters of primary healthcare.
Yes.
And I would want to also now go to the food science nutritionist, because a food scientist is one who has undertaken a BSc in food science and technology. But a food science nutritionist is a nutritionist that has undergone core curricula for human nutrition and dietetics, but with a concentrated niche in food science component and food technology components. So this is the nutritionist that we want to focus more on food industry service delivery when it on matters of products. So this nutritionist should be grounded in food science and build competencies also in the food industry framework which the focus is looking at the value chain of food processing from acquisition of the raw materials to the end product, and ensure that there is integrity in terms of processing output, and also there is integrity in terms of nutrient claims on that particular products. So they check the labels, and they also look at the marketing gimmicks which are on the food product, and advise the companies well on that matter. Now, this nutritionist also would be required even in health facilities, because when we talk of health facility service delivery, particularly for products, we have things like food products like parenteral feeds, which many times people have thought that they are drugs, but they are purely nutrients. We have normal saline, for example, is a nutrient. When we talk of things to do with we can call them the glucose, for example, that we provide, those are foods, they are nutrients. And many more that are being used for interventions, ready to use therapeutic foods. Those ones, and even plumpy nuts, those ones are foods, and their processing actually require the scientific integrity as guided by a food scientist. So they are actually the ones who should be telling the procurement and the nursing department what to bring on board and whether they are of good standards in terms of their value chain. And of course also for the general public, when we have different foods in the supermarkets, there must be a scientist that confirm that what is claimed on the package is actually true, and if it is true, then it is not harmful to the human life. So thank you very much. I think that is one. Now I want to go to other sub-specialties. On this line, we have people who have trained as clinical nutritionists, correct?
Yes.
And there are also those who have trained as community nutritionists. Now, particularly for clinical nutritionists, we have those that now want to build their competencies to high-level specialty. For example, somebody wants to dwell more on renal. So in this case, a clinical nutritionist can actually move further to ground themselves on a particular unit for service delivery. For example, they can choose to be renal nutritionists or critical care nutritionists, those who work in ICU. Such also, we take them through competency training programs in partnership with some of our approved CPD providers. And they do practicals to that effect. And we license them after oral examination in that line. So they will add a certificate on top of what they have already acquired. So such people can be a clinical nutritionist, but a specialist in renal nutrition, or a specialist in critical care nutrition, and a specialist in oncology, nutrition oncology. So those are subspecialties, and we have trained many. We have trained quite a number of subspecialties so that they just purely stay in the wards dealing with special cases like renal, and also special cases like even pediatrics, for example. So those are the kind of nutritionists that we have in the country. So thank you very much for that question, yes.
Thank you. Just before we conclude, Dr. Ari, kindly share some key takeaways maybe to students who are aspiring to do nutrition.
Yes, I want to start by, first of all, looking at the current career progression in the service delivery area and schemes of service. Now, we know that all nutritionists who want to pursue the subject as students, they want to see the final end. That is, where are they going to be placed or employed? The first thing I would want to say is that any nutritionist training should not only look at employment, but look at the opportunity of private practice, as we discussed last week.
Yes.
But if they were to seek for employment, they would be employed as either technician or technologist or nutrition officer. That is the basic classification in the schemes of service at the moment. Yes. But we are working towards restructuring that classification to fit the current training. These were done by Public Service Commission in line with the, in collaboration with the ministries dealing with the sector, but it is now updated. So it is the time that we have now trained that we will have to engage the Public Service Commission and reclassify, both at national and county level, and reclassify nutrition professionals so that whoever trains and builds competence and is licensed in a particular area will find a relevant area to operate. Now, we still need all these nutritionists in the public service. And particularly, we need clinical nutritionists by virtue of the number of health facilities that we have. Yes. At the moment, we have understaffed departments of nutrition across the facilities. The last time we reviewed one of the health facilities to be graded to level 6, we discovered that out of 40 nutritionists required, there were only 2 employed. So we have a big gap in implementation of norms and standards when it comes to the ratio of nutritionists to patient. The same applies to the ratio of nutritionists to the population. It's still quite low. And so we would want to really emphasize on the fact that there's a need to incorporate nutritionists. We have only 15,000 nutritionists now, and the active ones are about 10,000. We are training only 1,200 every year, and that means we could be having a total of 16,000 in the next, maybe 16, that is 15 plus 6, that would be 20, but active one would be 16,000. That is still very low. So we still have opportunities. The only thing left is that the policymakers must now refocus on nutrition as a solution to reducing our losses in terms of expenditure in hospitals, and engage nutritionists to actively participate in the primary healthcare as well as curative, and also in the areas of agriculture. When they do that, we will absorb these nutritionists and we can have an impact. So we still want to encourage young ones to join nutrition in any course that is accredited, and then as they do so, they should have a focus and say that they would want to come as change agents in the future. And if they come as change agents, then we expect them to enter the human resource for health workforce and solve the problems of nutrition in the country, both at community level and even at the curative level within the health facilities. We also want to prepare the policy makers that they should be ready for a change, so that the traditional structure that existed can now be reviewed again to include, to be aligned with the training and expertise that is being provided within the sector. If that happens, then we'll be in the correct direction, and so we'll still have students enrolling for the program and continuing. Otherwise, I would want to say that nutrition is one of the best courses that can save this country, given that 70% of diseases, 70% of non-communicable diseases actually have their roots from nutrition and other lifestyle characteristics that we have within our communities. Thank you very much, Laura.
Thank you very much, Dr. We've come to the end of today's session. Thank you for the valuable insights. To our viewers, thank you for joining in. Kindly subscribe and tune in next week for another very interesting topic. Goodbye. Remember to eat informed. From your host, Wang'ara Laura.